Thanks, Mersh. I'm really surprised he's saying it's your money. It's usually the department telling us it's their money. But anyway, that's an aside. And I can already predict in advance that this won't be the first time that Mersh is winding me up and telling me to hush. So I'm going to, I'm not from Cork like Norman, but I'm going to speak pretty quickly because I'm just going to touch on a number of points today. Really more all ears today than talking from the HRB. The whole reason that we thought this was an ideal conference topic to have is that as we embarked on our strategy back in end of 2020 for 2021, we're really grappling with this area, and it's about as clear as mud. An organisation like the Health Research Board, we know we have a role. I think that'll become clear. It's clear already. But what is that role? And where can we best add value? I was struck when, in the keynote talk at the start, the single UKRI budget to the living laboratory in Scotland was just under the entire budget of the Health Research Board. However, we know we have a role to play, and this is really what this event is about. And I suppose I'm just, in some ways, as people were talking, I was kind of thinking, oh God, is anything on the slide in terms of our reflections going to make sense? Are we over the course of the last 2 years trying to sense make in this space and trying to navigate our way through it? Are we on the kind of right pathway, at least of knowing the questions that we should be asking? And hopefully, I won't dwell on many of these issues because you've heard them all over the course of the day. But I suppose our reflection would be this area, even defining this area, is going to take and does take an unprecedented level of partnership amongst all of the stakeholders. I've listed some of them there. They've been familiar. Many of you are in this room. It's fantastic. And as well as trying to find mechanisms to bring those people together and those organizations together. Because I think part of our problem, if I'm honest, not just in this area, but more generally, is we bring really good, committed individuals together, but we're not bringing the organizations, the kind of body corporate. Really struck again by the early talk. Where is our triple helix? Who's talking about our triple helix? Who's leading it? So they're just questions that spring to mind. Again, look at the disciplines and the perspectives in this room. So it's multidisciplinary, it's transdisciplinary, it's the only way to go. We have to be outward connected, outward looking. We have to be connected. This is bigger than any one of us. That context that keeps coming up about the integration between the R&I system and the health system. I just don't think we're still grappling with this. We're trying to find out how this best works, and we have to find ways through this in this area. That line that used to be traditionally where there was research system on the one hand and a health system on the other, that paradigm doesn't work anymore. And I think we're trying to navigate our way in that. And many of you have mentioned we have to find a better way, our way in Ireland, to drive public and private partnerships, because otherwise innovation will not proceed. It's a bit of a no-brainer then, following on from that. As a research funder, at a minimum with research funding agencies, we have to find a way of cooperating, coordinating. I think we need an integrated policy framework, not one for the HRB, not one for SFI, not one for IRC, not one for the charities. We have to come together and map out a strategic research agenda, to kind of term that's used in Europe. And we've already heard all of the different research players that need to play a role here. For that reason, certainly our starting point in this space has to be looking externally, looking to others, north, south, to the UK, to Europe. We're in discussions under the Cancer Consortium about a precision oncology initiative. And you've already heard about those consortia that we have been engaged in IC PERMED, back when it was established in 2016. We've been involved in the ERA PERMED calls. Thankfully, Einar mentioned earlier, the 5th call earlier this year, and thankfully we have got some successful partners from Ireland funded in that. And you've also heard reference to the 1 Million Genomes initiative. A point, if I was to make no other point here today, I think we really are being remiss in not having a national joined-up conversation about technologies and research infrastructures. I don't know when we had our last PRTLI investment into the universities, but as you've heard, in personalised medicine, this goes way beyond the universities. We need the TUs, we need the traditional HEIs, we need to think about what spans the health system. And again, we heard from Anna about the concept of the living laboratory is, yes, you do have all of the players, academic and health system, but actually close to care. and on the campuses. And we've seen in the HRB how that is reaping dividends in our investment in the cancer clinical trials space, having it on the campuses of hospitals, making it simple and the easiest thing to do for those working in the health services. So this is just a plea from me in terms of we really haven't reaped a dividend even in Europe of Ireland's involvement. We have an ECRIN in the HRB. We could probably still do more in that space for clinical trials, but we have lots of other European infrastructures where Ireland is not engaged to the extent. We may be a member country, but we're not engaging and we're not getting stuck into that in the way we can, and that will benefit us in this space. I'm not going to labour this too much other than saying this is an area that the HRB has spent a lot of space working very closely in the last 2 years with the Department of Health in preparation for the Health Information Bill, very connected in terms of what Ciara has talked there about the European health data space. We're a data provider in the HRB. We're also a funder of research. So I think, you know, back to, I mean, Ros Moran is here in the room, ex-HRB and an author of the DAZZLE report, an infrastructure for data access, sharing and linkage. And we have pursued that. We will have a technical proof of concept coming up soon. And these issues that we're involved in Europe, not just in the HRB, but Ireland is involved in, is really, really important to this space because we need to invest in trusted research environments or safe havens, whatever word you're having yourself, and federated data analysis. I'm not going to talk about this because Ciara has, but it's very clear, our reflections, is that we need fit-for-purpose regulatory frameworks that support responsible R&I, that are acceptable to the for the healthcare professionals, for the patients and the broader public. And consent has been mentioned. I'm going to just say a word about biobanking, which I'm kind of just really, just to say it out loud, both in terms of on the occasion of the publication yesterday or the approval by the Cabinet of a human tissue bill. That is a great start, but does not bring us forward in this area. And Murish and his colleagues are absolutely blue to the face and listening to us talking about this. But a large part of the issues that we have, because you cannot separate what you're doing for the samples and the data. And we tie ourselves up in knots talking about regulation and frameworks for the samples of the data. We need to put a consolidated framework together that will ensure that the collection, the storage, the transport, the use, the reuse, the data that comes from the samples, that we have a joined up framework. And actually this space, this topic is a really, really good area for us to actually map that out. And again, some of our regulatory approval colleagues in the room, and many of you in the room, have mentioned challenges and uncertainties around approval, whether it be around companion diagnostics or ATMPs and the traditional rules of GMP and so on. And again, I'm not going through all of these issues other than to say I'm delighted that they have come up today, that we're having a conversation about them, and I'm sure there's many more things that we can add there. And these are some of the issues that we need to coordinate, cooperate, and map in new paradigms. Clinical trials has come up repeatedly, and really between methodologists and trialists and CRF directors and so on, we have many people in the room today. So I think absolutely we need to be having those conversations about adaptive platforms, you know, the whole N is equal to 1 trials. And importantly, we've talked a lot about the legacy from COVID, observational data, data in the real world. That can supplement, that can complement, that can wrap around trials data. And again, we have our HRB-funded Trials Methodology Research Network. We have entities, as Einar mentioned, the PERMIT, which looks at design and statistic issues around trials in Europe. So there is a way forward here. General, this is a catch-all. The Health Research Board, as many of you will know, we fund clinical research, health services research, and implementation research, population health research. We're not the funder or the budget of basic or fundamental research and so on. But actually, we all need to work together in this space, both in terms of advancing that funding in that fundamental space. But for us, things like clinical utility, health economics, implementation, what does this mean for the workforce? What about access, utilization, equity, preferences has been mentioned a lot, acceptability, communication, literacy, outcomes research, experiences. This is the space that we really see ourselves playing a role, and we want to be working with you and other partners in. So this is my final slide, which is saying, We still have more questions than we have answers, but we were hoping to tap into the collective knowledge, the solutions, the energy, the enthusiasm in this room and beyond, because there are questions for us about the scale of investment, opportunity cost, if you want to call it that. It was mentioned earlier. If we were funding in this space, would it be project? Would it be longer term funding? Would it be infrastructure? Would it be individuals? Would it be centres? Would it be networks? Where are we at in Ireland at this point? Where would we add most value with others? Where to start with capacity building? There's lots. There's new roles, I've heard today, in the research workforce and in the health workforce. And we know there are implications for us in the research assessment process. So to conclude, I'm going to come back to the slide I mentioned earlier. I think it is about cooperation. It is about coordination. We need an integrated policy framework. We need to get together about a strategic research agenda. And I would just pose a question, because we need that to start, and we need somebody to take the lead. I would like health to take a lead in that, alongside education and alongside enterprise and alongside patient groups and charities and so on. And perhaps Ireland joining and committing to join the European Partnership on Personalised Medicine, where we are required to set up a hub, as Einar called it, or a national mirror group. Perhaps this is the opportunity to build on the energy in this room and to get us all together to cooperate and to coordinate towards that strategic research agenda. Thank you.